Hello sir, good evening. My name is Sushmita. So we have Dr. Amit Bhushan from Paras Hospital, Gurgaon. He's a renowned cardiologist, director of Paras Healthcare. And sir, on the occasion of this World Heart Day, I just wanted to ask few questions about healthy heart, heart, like breathlessness and lung, heart disease and this kind of questions. So let's start with sir. I just wanted to know, in this current situation, we are is this shortness of breath because of lung or because of heart, sir?
A very good question you've asked. Shortness of breath, sometimes we may mistake it as asthma. But anybody who's having shortness of breath, let's say after the age of 50, he's walking for about 5 kilometers and now he says he gets short of breath after 200 meters or 500 meters. So then that is not asthma. So that is basically a classical supply-demand mismatch. That means demand is increasing on walking but the supply is not getting there. So as a result, a blockage is building up. Second, shortness of breath, especially in diabetic patients, if they complain of shortness of breath after the age of 50, it is not asthma. Asthma is a disease of adolescence. If anybody, diabetic patients complaining of shortness of breath after 50, rule out a heart disease. After 50, diabetic complaining of acidity, gastritis, rule out a heart disease. Acidity, gastritis or a bronchial asthma may not kill you, but heart disease can definitely be fatal. Second differentiation between shortness of breath is if the shortness of breath increases on lying down, the patient starts coughing during lying down and tells you that the moment I lie down I feel short of breath. That means there is congestive heart failure. The heart is failing as a pump.
Okay.
The blood is not going forwards. It is going back into the lungs. Lungs are getting congested. The moment he lies down, he starts getting choking feeling. The moment he sits up, the water level goes down. He starts feeling a little better. So it is very important to differentiate whether this shortness of breath is asthma or because of heart.
Okay.
There are certain blood tests. There's a blood test called as NT-proBNP.
Okay.
The value is less than 150. It's a spot test. It's like a pregnancy test. Immediately you get the report.
Okay.
Value is less than 150. The shortness of breath is because of lungs. Value more than 150. The shortness of breath is because of heart.
Okay. So my next question is, sir, what is heart failure or heart attack? Is both the same or?
Heart failure and heart attack are two different etiologies. Heart attack is there are 3 blood vessels in the heart. If they get one of them get blocked, the blood supply to that area is lost and causes a heart attack.
Okay.
If the heart attack is not treated in time, it can cause either a sudden cardiac death or if the patient survives but the heart muscle dies, that results in congestive heart failure. When you have a heart failure, the heart pumping decreases. Normal heart pumping is 55 to 65%. So when a part of the heart dies, the heart muscle dies and the heart functioning reduces. This is called as congestive heart failure. When you have a heart failure, 3 things happen. One is what the patient sees, one is what the doctor sees, third is what nobody sees. Patient sees this classical shortness of breath. The shortness of breath increases on lying down. The moment you sit up, you start feeling better. It may or may not be associated with swelling in the legs, swelling in the abdomen, and he classically feels that I have shortness of breath and coughing sensation at night.
Okay.
Second is what the doctor sees. Doctor sees as multi-organ failure. The heart is failing as a pump. Let's say for example your heart functioning is 25%. So all organs in your body are receiving only 25% of the blood flow. So if brain receives 1 liter, he is receiving only 25%. So 25% means 250 ml. The risk of stroke, memory loss, Alzheimer's, everything is there. Same way kidneys are supposed to receive 2 liters and they are receiving only 25%. So kidneys also fail. Intestines or liver also gets less blood supply. So you have loss of appetite and resulting in multi-organ failure. This is what the doctor sees. The third thing is what nobody sees is the risk of sudden death. So out of 4 wheels, 3 wheels are already punctured when your heart functioning is 25%. So car can topple over any time. You can die during sleep, you can die during walking. And this is the set of population where sudden cardiac death is real. So the remedy of that, you must have seen people getting shocked in the movies. So obviously you cannot buy that machine at home. So that is called as a cardiac defibrillator. There is something called as an implantable cardiac defibrillator. Third thing is a cardiac defibrillator. Normally you must have seen people getting shocked in the movies. Obviously that machine you cannot get at home. So there is something called as an implantable cardiac defibrillator, which is size of a matchbox, implanted it below the collarbone. What it does is it overtakes your normal heart rhythm. If there's an abnormal rhythm, it will try to overtake it and stop it. Second, if it doesn't happen, then it shocks and saves your life. Third, it also works as a pacemaker, and sometimes it also improves the heart functioning. So anybody whose ejection fraction or heart pumping is less than 35% is equal to end-stage cancer. Only thing is, end-stage cancer may have limited opportunities or limited treatments available. Less than 35% congestive heart failure, multiple treatments are available. Second thing is, less than 35% heart pumping patient does not know that he is going, while the cancer patient is aware that he will die soon. So the awareness has to be made that 35%, less than 35% is a death knell for the patient and can be improved if we take proper precautions. Then you ask the same thing going forward. So ये तो आपने बताया, this thing you told about the various treatments available. Can the patient do anything at home for heart failure? Any home remedies for heart?
So my third question is, sir, is there any home remedies for heart failure?
Yeah, very nice question, Sushmita, you asked. Home remedies for heart failure means heart failure is already a burnt out phase.
Okay.
That means the heart muscle is already dead. So at that point of time, there is no medicine to improve the heart functioning. Any cardiologist who invents it will win a Nobel Prize. So what happens is, now with that current scenario, you have to make sure that prevention and utmost treatment monitoring is the key. Your major enemy now is not ghee tel, your major enemy is now salt and water. So fluid restriction, everything, pani, doodh, juice, soup, chai, coffee, dahi, lassi, everything has to be less than 1.5 liters a day, and no added salt in the diet. Probably if anybody wants to add salt, he puts it according to his own taste and he precisely knows how much salt am I putting. So that is there. Second is daily monitoring and weekly monitoring. Daily monitoring of heart failure means he should be monitoring his pulse and blood pressure. Normal blood pressure is 120/80. In patients with low heart functioning, their normal pressure is 100/70. If it goes to beyond 120/130, that means fluid is building up.
Alright.
Pulse rate should be 60 to 70. His saturation should be beyond 95%. So these are the three numbers you should be looking at daily: pulse, blood pressure, oxygen saturation, and maybe fasting blood sugar if he is a diabetic. So these four numbers you have to monitor daily, and there is something called as a weekly monitoring. One Sunday a month or one Sunday a week, what you should do is monitor his weight. If the weight is increasing, that means the fluid is building up. Second thing is monitor his 24 hours urine output. 24 hours urine output means that you give him a 24 hours urine measuring pot. You measure the urine from 7 o'clock in the morning to next day 7 o'clock. Ideally it should be more than 2 liters. If it is less than 1.5 liters, he has to contact his physician or cardiologist.
Alright, sir.
So for heart failure is a multidisciplinary approach, treatment correlation between the doctor, between the patient and the caregivers. So daily monitoring, weekly monitoring is very important for the patient at home to prevent readmissions for heart failure, in addition to the device therapies and other therapies which we discussed.
Okay. So my next question is, sir, can valve replacement without open heart surgery, is it possible, or what is the procedure for valve replacement, sir?
Yeah, again a pertinent question, Sushmita. Valve replacements can be done without open heart surgery. About 15 years ago, if somebody had said that you can replace the valve without open heart surgery, people would have laughed at it.
Okay.
But now it is a reality.
Okay.
Yes, we can replace the valve without the need for open heart surgery, without the need for general anesthesia, without any scars, without any stitches.
Okay.
It's the patient goes home in 24 to 48 hours.
Okay.
And it is done rightly through the groin or through the hand.
Okay.
Just like we put a stent, the valve can be replaced.
Okay.
So that procedure is called as TAVR, TAVR,
Okay.
transcatheter valve replacement of aortic valve.
Okay.
And there is TMVR, which is transcatheter mitral valve replacements of the mitral valve.
Okay.
So all this is a possibility. Then there are mitral clips which are available to decrease the mitral valve leakage. Then there is another valve on the right side which is called a tricuspid valve. A tric valve is available, or tric clips are available to replace the valve or to treat the valve without open heart surgery. and without open heart surgery